Did you know that nearly 60% of diabetic patients unknowingly risk their health by combining certain vitamins and medications? Yes, you heard that right. It's a shocking statistic that underscores an often overlooked aspect of diabetes management: vitamin-medicine interactions. It's no secret that diabetes is a complex disease that requires careful management. But what many people don't realize is that this management extends beyond just monitoring blood sugar levels and taking prescribed medications. It also includes paying close attention to the vitamins you're taking and how they might interact with your diabetes medicines. These interactions can be harmful, sometimes even life-threatening. Yet, the majority of diabetic patients are unaware of this hidden danger. It's time to shed light on this critical issue and give you the knowledge you need to safely manage your diabetes. So let's delve deeper into this hidden danger and how you can avoid it. Before we delve into the details, if you value the information and research invested in creating this video, your support is greatly appreciated if you hit the like button and hit subscribe. Thank you. Let's get started. It's crucial to grasp what diabetes is. At its core, diabetes is a chronic condition that affects the body's ability to process sugar. Our bodies are like complex machines, and sugar, or glucose, is the fuel that keeps us running. To get this fuel into our cells, we need a hormone called insulin. Presently, there exist two primary forms of diabetes. In type 1, the body doesn't produce insulin at all. This type usually develops in childhood or adolescence, hence it's often referred to as juvenile diabetes. It's a bit like having a car, but no fuel to run it. So, people with type 1 diabetes have to take insulin every day to help their bodies use glucose and avoid life-threatening complications. On the other hand, in type 2 diabetes, the body either doesn't produce enough insulin or doesn't use it well. This is the more common type and usually develops in adulthood, though we're seeing it in younger people too. It's akin to having a car and fuel, but the fuel is contaminated, so the car doesn't run smoothly. In both types, the end result is the same. Too much sugar stays in your blood and not enough reaches your cells. Over a period, elevated blood sugar levels can result in serious health problems affecting the heart, kidneys, eyes, and nerves. But don't lose heart. With appropriate measures, diabetes can be effectively controlled. Approach, which includes consistent monitoring of blood sugar levels, a balanced diet, regular exercise, and medication. Now that we understand the basics of diabetes, let's explore how vitamins can interact with your diabetes medications. You might be surprised to learn that not all vitamins play well with these drugs. So, stick around to find out which ones could be causing an unexpected tango in your system. Vitamins are crucial for our health, but certain combinations with diabetes medication can spell trouble. Let's delve into the most dangerous vitamin-medicine interactions for diabetics. First off, we have vitamin B3, niacin, and statins. The interaction between vitamin B3, niacin, and statins, commonly used for managing cholesterol levels in diabetes, presents significant risks. Niacin, a water-soluble vitamin crucial for metabolic processes and nerve function, can induce liver toxicity, especially in high doses. Statins, which inhibit liver enzymes involved in cholesterol production, may also affect liver function, raising concerns of liver damage when combined with niacin. Additionally, niacin's potential to induce insulin resistance and elevate blood sugar levels, coupled with statin's modest impact on glucose levels, increases the risk of worsened glycemic control in diabetic patients when both medications are used together. Conversely, the interaction between vitamin C and metformin, a cornerstone medication for type 2 diabetes, is noteworthy. High doses of vitamin C can compromise metformin's efficacy by interfering with insulin sensitivity, potentially diminishing its ability to lower blood sugar levels. Moreover, vitamin C may exacerbate gastrointestinal symptoms associated with metformin use, further complicating diabetes management. To address these concerns, healthcare providers must educate patients on discussing all supplements to ensure treatment effectiveness. Regular monitoring of blood glucose levels and gastrointestinal symptoms is essential when combining vitamin C and metformin. This allows for timely adjustments to treatment regimens to maintain glycemic control and minimize adverse effects. The combination of vitamin E and blood-thinning medications like warfarin poses significant risks for individuals with diabetes. Vitamin E, functioning as an antioxidant, disrupts blood clotting by inhibiting platelet aggregation, while warfarin, an anticoagulant, blocks vitamin K's activity, reducing clotting factors production in the liver. When used together, these effects can intensify, increasing the risk of bleeding complications. This enhanced anticoagulation heightens susceptibility to issues such as easy bruising, nosebleeds, and prolonged bleeding from minor injuries, potentially leading to severe hemorrhage, especially concerning individuals with compromised blood vessel health. Moreover, inter-individual variability in this interaction, influenced by genetics and health status, highlights the need for personalized healthcare and close monitoring. Healthcare providers must tailor treatment and surveillance strategies to mitigate risks and optimize outcomes. This underscores the importance of thorough discussions between patients and healthcare providers about medication interactions, particularly for those with diabetes, who may already have heightened vulnerability to vascular complications. The interaction between vitamin B12 and metformin is indeed a significant consideration in the treatment of type 2 diabetes. Metformin is a cornerstone medication in the treatment of type 2 diabetes. It is valued for its capacity to reduce blood sugar levels by enhancing insulin sensitivity and decreasing glucose production in the liver. However, it is associated with a lesser-known side effect: decreased absorption of vitamin B12. Vitamin B12 is essential for various physiological roles include the generation of red blood cells, upkeep of the nervous system, and synthesis of DNA. A deficiency in vitamin B12 can lead to serious health issues, including anemia, nerve damage, peripheral neuropathy, and cognitive difficulties such as memory loss and difficulty concentrating. The mechanism by which metformin interferes with vitamin B12 absorption is not entirely understood, but it is believed to involve alterations in gastrointestinal pH and changes in calcium-dependent membrane actions in the intestine. Research has shown that regular monitoring of vitamin B12 levels in long-term metformin users is beneficial. However, healthcare professionals should guide supplementation to guarantee proper dosage and prevent potential complications. Vitamin K, crucial for blood clotting, interacts with anticoagulants like warfarin, commonly prescribed to diabetics for clot management. These medications inhibit vitamin K's effects, preventing clot formation. Increasing vitamin K intake through diet or supplements can counteract anticoagulant effects, heightening clot risk. Balancing this requires vigilant monitoring and healthcare provider communication. The complication of taking vitamin K and warfarin together in a person with diabetes is that vitamin K can affect the blood-thinning effects of warfarin. This interaction can potentially lead to fluctuations in blood clotting levels, which may increase the risk of complications such as excessive bleeding or clot formation. St. John's wort is often used for its mood-lifting effects, especially by individuals coping with chronic illnesses like diabetes. However, it can reduce the effectiveness of medications, including those for diabetes, by speeding up their breakdown in the liver. This can result in insufficient levels of diabetes medication, leading to poor glycemic control and related complications. It's crucial to discuss all supplements with healthcare providers to avoid such interactions. The most surprising and dangerous interaction for diabetics involves calcium supplements and certain diabetes medications, like thiazolidinedionase. These medications boost insulin sensitivity, but when combined with high doses of calcium supplements, there's a risk of edema or swelling due to fluid retention in tissues. This is alarming as edema not only causes discomfort, but can worsen heart failure, a heightened risk for individuals with diabetes. This interaction highlights the necessity for comprehensive diabetes management, ensuring that supplements and medications are coordinated to promote overall health without unforeseen complications. Managing your vitamin intake doesn't have to feel like walking a tightrope. It's all about being mindful, informed, and proactive. Let's dive into some practical advice that can help you navigate this journey safely. Firstly, it's important to remember that not all vitamins are created equal. Various vitamins fulfill distinct roles within our bodies, and while some can be beneficial, others can interact with your medication, leading to unforeseen complications. So how can you ensure you're getting the right balance? The answer is simpler than you might think. Always seek guidance from your healthcare provider before starting any new supplement. It might seem like a minor step, but it can make a world of difference. Your healthcare provider knows your medical history, your current medicines, and your unique needs. They can guide you on the right path, helping you understand which vitamins will complement your diabetes management and which ones you may need to avoid. Next, make it a habit to read labels carefully. Yes, it can be overwhelming to see a long list of ingredients on the back of your vitamin bottle, but understanding what you're putting into your body is crucial. Look out for any ingredients that your healthcare provider has advised you to avoid. Also, be wary of any miracle claims. Remember, if it sounds too good to be true, it probably is. Lastly, don't forget the power of a balanced diet. Many essential vitamins can be found in the foods we eat. A diet plentiful in fruits, vegetables, lean proteins, and whole grains provides a varied spectrum of vitamins and minerals, lessening reliance on supplements. We've journeyed through the hidden dangers of vitamin-medicine interactions, especially for those managing diabetes. We've delved into the complexities of diabetes, a condition impacting millions worldwide, and how certain vitamins can either be a boon or a bane when combined with certain medications. While vitamins are essential for our health, it's crucial to remember that more isn't always better. Remember, your health is a lifelong journey. It's about making informed decisions, about understanding the interactions between what you consume and the medicines you take. So if you found this video helpful, don't keep it to yourself. Share it with your friends, family, and social circles. And remember to subscribe for more health insights. Thanks for watching, and see you in the next video.